Welcome to the Expert Edge. This is the show where we bring on experts in their fields of health and wellness practice to hear their stories and learn what they see working in the field of diabetes reversal and prevention. And I'm really happy to introduce today's expert, Dr. Cate Collings. Welcome.
Thank you for having me. I'm excited to be here.
I'm so excited to have you here as well. Dr. Cate Collins is a cardiologist. She is an exercise nutrition and lifestyle specialist. So she's an MD, as well as having a whole string of other acronyms after her name, including being a diplomat, I think that's how you call it, of the American College of Lifestyle Medicine. And she's also a certified health coach. So you know that she's been working in this area that we've been talking about for a while now and really has a background, I believe, to bring you some true value today. Stick around for her free gift at the end of today's session because you will want to take advantage of this. Now, Dr. Collins has served in several regional and national leadership roles. She is the past president of the American College of Lifestyle Medicine and is now also a delegate to the American Medical Association on their behalf. She comes to us with over 3 decades of experience as a clinician, serving patients with acutely life-threatening and chronic conditions. And so she has a passion to really help people succeed while they're still well enough to work. She wants to help them mitigate burnout and have the good health that they dream of for decades after their career. So I am so glad to have you, and I want people to know that you also love doing things besides seeing patients, like cycling, tennis, skiing, worldwide active adventures, and she loves hosting plant-based eating events to foster connections and joy in her personal life. So I'm just so glad to have you here, and I can't wait to dive into our topic for today. But let's start by telling us a little bit about what drew you towards this area of lifestyle medicine after working as an MD cardiologist in that very medical allopathic specialty.
Absolutely. Well, you're absolutely right. And so, but go back a little bit before I went to medical school and I was an exercise physiologist. So it was
Mm.
there that I really saw the research of exercise science. I was interested in nutrition, but at that point I was really interested in the exercise sciences. Fast forward, I'm in medical school. None of that research and none of that comes into medical education.
Mm.
We go, completely into pharmaceuticals and procedures, and exercise and other lifestyle interventions are really a side course.
Mm.
So I learned that. I went deep into that. And of course, getting into the field of cardiology, which I loved because of the physiology. You could apply some exercise physiology. I was in a massive growth phase of cardiology, when we had all these advanced pharmaceuticals, when we had advanced procedures, right? The ability to intervene in the middle of someone's heart attack.
Mm.
I love that. I love being able to do that. I love the intellectual stimulation, everything about it. But during those 3 decades of practicing cardiology, it became clear to me that my patients, while I could save them from this life-saving thing, we weren't really getting at the root cause of their disease condition in the first place. And they were coming back with other lifestyle-borne conditions, diabetes, obesity, cancers.
Mm.
And so, despite this advancement in pharmaceuticals and procedures, the prevalence of these conditions and what I was seeing in my own patients um, was still going rampant, right? And cardiovascular disease still the leading cause of death. So it's sort of the tail end of my cardiology career, mid to late, that I became acquainted with the field of lifestyle medicine. And suddenly I was in the room with like-minded professionals that wanted to take that research off
Mm.
the shelf, the nutrition research, the exercise research, the sleep research, and put it into clinical practice. And so it wasn't a hard sell for me to quickly find that that was really my tribe. Those were physicians and other health professionals who were really interested in healing and not just putting a Band-Aid on these disease conditions. So it was a really exciting trajectory and pivot for me.
That makes sense. But a lot of people still ask the question, like, hasn't there been a real immense growth in pharmaceuticals and procedures in cardiology and diabetes that can solve our health problems?
Right, they're still Band-Aids though. They are
Mm,
still Band-Aids because they're still not getting at the root cause. And while I am not saying we shouldn't have medications and procedures, we need them and we will always need them. They should be used, in my opinion, as an adjunct where
mm,
lifestyle should be at the foundation of how we treat. Sure, there's cases where we can't just use lifestyle out of the box right away in the middle of a heart attack. But when we're talking about preventing the next heart attack and so forth, then we can lay that foundation of lifestyle and begin to um, prioritize it. You know,
mm,
lifestyle counseling has been in clinical guidelines across all these conditions for years as the first thing to do with a patient, whether that's cardiovascular disease, hypertension, heart disease, diabetes, obesity, overweight, cancer. And what I say is what's happened over the years is our physicians haven't been trained enough. And so they
mm.
just kind of take a hurdle over that first guideline in the patient's management and go right to the second guideline, which is the first level of medications. And so the patient experiences medications as the first line of therapy instead of truly experiencing lifestyle as the first clinical intervention for their newly recognized condition. And so that's a mindset, for both physicians, how they have to be trained, but it's also a mindset in what patients have come to accept and expect. That, well, of course, if I'm here, my doctor is going to prescribe a medication. So I think we have to bring enlightened patients to begin to work with their physicians to get more lifestyle information or be referred to somebody who's a lifestyle specialist. And now we have so many clinicians trained in the field.
Yes, I was so excited when the American College of Lifestyle Medicine was organized.
Yeah.
I grew up in a household where my dad was a physician, my mother was a nurse, and they were very interested in preventive medicine. In fact, my dad went back and he got like a master's in public health because he's like, I want to keep people from getting sick. And that was long before ACLM was organized.
Yeah.
And, I think we probably have a mutual friend in Dr. Wayne Dysinger. I actually grew up with his family in Loma Linda.
Wonderful.
Yeah, we're really good friends with that family. And we were all kind of there together in a similar environment, looking at how can we promote people's health and keep them
Yeah.
from getting sick. And, with the organization of the college, I believe that it really helped exponentially grow the field of lifestyle medicine. And I'd love for you to tell us a little more about why this is so essential for our nation's health. As a previous president of the association, what do you see?
Yeah. Thank you for that. And that's fun to know that you were childhood friends with Wayne because he's
Yes.
been so instrumental in starting the field, which for the audience, really the college started in about 2004 and was an outgrowth of the American College of Preventive Medicine, PrevMed certified physicians who felt that we need to go beyond the concept of prevention to the concept of treatment, if not remission of
Mhm.
disease, and that we had the data for that, but we needed to bring that to the limelight and bring those people together. So, the college has grown. I'm going to give the audience the actual official definition of lifestyle medicine as a way to level set. And it is a medical specialty, now board certified since 2017, that uses therapeutic lifestyle interventions, way above counseling, as a primary modality to treat conditions, including but not limited to heart disease, type 2 diabetes, and obesity. And so, lifestyle medicine certified clinicians are trained to apply evidence based, whole person, prescriptive lifestyle change to treat, and when used intensively, often reverse such conditions. And so, remember that these are the conditions with the highest morbidity and mortality in our country and actually globally. And our membership has grown to over 13,000 now. We are an interdisciplinary medical association with more than 50% of our members are MDs or DOs, and the other 50% are RNs. They're uh, physical therapists, exercise specialists, nutritionists, the whole thing, because lifestyle medicine is truly an interdisciplinary sport. So I also want the audience to know that you may be closer to having a lifestyle medicine certified physician in your community because we globally have 8,000 people certified in lifestyle medicine.
I
And
love that.
in the United States, more than 5,000. And we have, you know, probably close to 100 or more health systems that have a lifestyle medicine champion. So certainly somebody in their system who's lifestyle medicine certified. So it's more likely now that there is someone that's lifestyle medicine certified in every community.
Mm. I think that's amazing. And that's such a resource. And I like people to know that now this is actually like a new category of practitioner that we haven't had before. These are people that have been through standard medical school in many cases or some other area of health. And then by becoming certified in lifestyle medicine, it means they know how to use these techniques to help you reverse chronic disease. And so when a physician is board certified in lifestyle medicine, it means they've actually done all of that additional training outside of medical school to be specialized in helping you and guiding you to implement lifestyle interventions that will actually help you to not just put a band-aid on your disease, but reverse it. So, what are some of the pillars of lifestyle medicine that all of these practitioners would use in common?
Yeah. So yes, we think as lifestyle medicine practitioners around six pillars: nutrition, whole food, plant predominant or plant-based eating pattern. We think about exercise interventions, meeting people where they're at. It's not a one size fits all or a boot camp. And I would be remiss to give people that impression
Yes.
because that's not really what lifestyle medicine practitioners do. Sleep is an important pillar of lifestyle medicine because we know sleep is bidirectionally involved in all sorts of things, hormones, our eating patterns, our mood, our decision making around behaviors. These beauty of these, and I will cover the other three, is that they all are interdimensional with one another or bidirectional, multidirectional with one another. Stress management is a big pillar of lifestyle medicine, as is avoidance of risky substances of all sorts, not just thinking in terms of alcohol and tobacco, but also all the things that we potentially are exposed to in our environment.
Mm.
Um, and then now you've got me stuck on the sixth pillar, which is social connection,
Yes.
which, I think we've seen, the light shone on that from the Surgeon General, right? Loneliness. And social connection has not only an impact on our mental and emotional health, but very, very much on our physical health and actually our morbidity and mortality. So it's a wonderful way to look at the constructs here and how they're all related and how, in fact, it is whole person care. It is whole human care that we're really invested in the field of lifestyle medicine.
I really love that. And I'm so excited as I see this growth happening in this area of how to deal with disease and preventing it or reversing it rather than just trying to fix the symptoms. Now, we have people that are listening that might be really interested in trying to find a practitioner that is certified in this field. Is there a directory or a place where they can go to like find some practitioners that, for example, might do lifestyle medicine in a telemedicine format, like if it's not in their own community yet?
Yes, there are. There is in the Los Angeles area, I think it's Live Life, if I'm not mistaken, will have lifestyle medicine certified physicians in their network. That is a subscription model. And
Hmm.
again, grain of salt, since I'm not associated with them,
Yeah.
I don't want to misrepresent them, but that is the national, telehealth, less so. Going to lifestylemedicine.org, which is our website for the American College of Lifestyle Medicine. They are developing a registry of
Mm.
physicians that are members, if not certified in the field.
That's really helpful, I think, because sometimes it's hard to locate people that really hold this philosophy and are supportive of lifestyle approaches. I know in my own work, as I'm coaching people with a lifestyle approach, they often kind of bump up against physicians that either dismiss all of those efforts as, well, do
Mhm.
whatever you want, but here's your prescription,
Yeah.
or we'll tell them, I don't know anything about this, I can't really support you. And sometimes we'll even say, they just throw up their hands. It's like, well, I guess you're non-compliant, right? So so I'm really happy to see more and more resources along these lines. So what are ways in which maybe you have had experience with clients or worked with people that dealing with diabetes and the closely related disease of heart disease, because they kind of go hand in glove,
Yeah.
and how you've seen some of these principles actually change people?
Right. So in the work that I did in a healthcare system in setting up a lifestyle medicine program, we would consider the diabetes and life and cardiovascular disease to be exactly as you said, one and the same with the same principles, and just drawing people to the skill sets, particularly of how they eat. And so we led shared medical appointment culinary programs to really give people hands-on experience in preparing food and in making healthful food. It doesn't have to be as complicated as people sometimes make it out to be. So that and then also learning and setting up the support system for patients to learn from one another.
Hmm.
Um, the same pillars of lifestyle medicine apply because as we get further and further into understanding the root cause of these conditions, we realize they're oftentimes one and the same. It's a disruption of epigenetics.
Hmm.
It's a disruption of the microbiome. There's some cellular injury in there. And all of those drive inflammation, and inflammation drives these chronic diseases. We talked about cardiovascular disease and diabetes and oncology, but something that is very top of mind for many people now is cognition and aging
Top of
and
mind,
having
no pun intended.
exactly. Yeah. So, I think that the research is really honing in on lifestyle changes that directly and rather rapidly can affect positively cognition and dementia. So that's an exciting new area of lifestyle medicine.
It absolutely is. And currently, I understand that you actually work with people in a coaching relationship to help them reverse diabetes or other chronic illnesses. Can you
Mhm.
tell us about some of your experiences with those clients?
Yes, and I'm so excited about the field of coaching. So thank you for that question because during my clinical years I had very little time to do that. I always tried to have some part of my appointment step back, connect with people through a different lens of a coaching lens and what they want in their life, and begin the process of helping them envision that and envision their role. But now, as I have moved out of clinical responsibilities, I'm able to really devote all of my time to this, which is rewarding because I begin to really understand um, how to help people craft that vision and help give them the support and the tools to move their disease trajectory in the best direction. And that, of course, will translate into their quality of life and their vitality and health span and enjoyment and all of the other goals that they have. Um, yeah,
I love that.
yeah.
So I would love to hear a story of someone who actually saw their life turn around as they implemented some of these principles. Can you share a story with us?
Sure. So the story I think that was so meaningful to me, and this is oftentimes the situation for me, is when I can have somebody shift their way of thinking. And this was a client that wanted to get healthier in several ways, actually had weight as a pretty big focus. But when we dug deeper into that, what did that mean to her in this situation? And that meant self-confidence in certain situations. And so self-confidence became more the vision of what her larger vision was. She wanted to carry herself in that way. And we were able to arrive at a point where it would be okay if the number on the scale didn't change, but her self-confidence and her feeling of health improved. And of course, setting that as the North Star, a lot of things can fall into place that will get those other tangible health outcomes. They will get, for instance, a change in weight because we can put the steps into that. They will get a change in the improvement of nutrition. And if diabetes reversal is a goal, it will set into place those steps that lead into that direction. Um, so getting that deeper feeling about what it is somebody wants is such an important first step. And to allow that to be there without maybe specific health outcomes at that stage yet. Um, the health outcomes of showing a different number on a scale or showing a different cholesterol number or showing a different blood glucose number. Sure, those can be there, but we still have to have that North Star and to create that meaning within people.
Hmm.
And that's what's, I think, very exciting about health coaching. It's very different than telling someone what to do or putting them in boot camp.
Yes, it is. And I appreciate you bringing out that difference. And, sometimes people are ready for different kinds of approaches at different stages in their life.
Agree with you.
It reminds me of one of the clients that I worked with that had diabetes and really earnestly wanted to turn his numbers around.
Mhm.
And lived a very full life. He was very social. He was older, still playing, musical instruments in church. And as he just simply learned some of the principles of lifestyle medicine, like how to use food as medicine, how to move on a regular basis, and the timing of that, and the type of exercise, he dropped his hemoglobin A1C like 2 full points in like 3 months
Mhm.
and felt so much better and was able to get off of his blood pressure medications and get off of all of his blood sugar medications. And it just gave him such a lift in life, to experience that. And I think that as we walk with people on this journey, taking them wherever they happen to be, and then just what's the next step for you, right? What's the next step? And moving them forward, that it's really exciting to see how powerful these lifestyle medicine pillars actually are as they are implemented in people's lives. And that's kind of what keeps me going in this whole business as well, because I just love
Mhm.
seeing people's lives change, right? We love
Yes.
seeing them get a
And
spark in their eye.
yeah. And what you
It's,
point out there is that when he made, it sounds like your client that you described was, had a high degree of self-efficacy. It's sort of one of those clients that says, tell me what to do and I'll do it, right?
yeah.
And he did it. But then he saw the uh, synergistic or additive effect
Hmm.
on improving his blood pressure and all these other things, and then also, increased vitality. Ultimately, people want to feel better. Um,
Yes.
and so wherever somebody is, whatever they want is the starting point. And then from
Mm.
there, just a lot of gears start to pull together.
It is. It's amazing how it kind of, like you say, it builds on it, like
Yeah.
a little step, and then the benefits, and then it's like, oh, maybe it's worth putting more energy into or investing into
Yeah.
something. And
Yeah.
I love the role of coaching and walking alongside people as they are on their journey. And I want you to tell people a little bit about the free gift that you are offering them. As you're listening here to Dr. Cate Collins, she's bringing something in contribution to you, and I'm going to let her tell you about it.
Sure. So, yes, I would just love to meet some of your audience and help them in any way I can. And the way I look at that is coming in and talking with me for an hour, no strings attached, no outcomes needed. I enjoy people. I would enjoy meeting them and seeing if there is a place where I can help and learn about their life.
I love that. And so, if you want to schedule a complimentary, no strings attached, free coaching call for an hour with Dr. Cate Collings, just use the link in the description below this video and it will put you in touch with what you need to do to get that appointment set up. So, I want to encourage you to do that and get some input on what might be your best next step to health. Because remember that health is wealth. And it comes by choice, not by chance. I want to thank you for being here with us today. And thank you for your great, valuable information that we've been able to enjoy today, Dr. Collings. And I'm looking forward to people connecting with you as well.
Thank you so much.